Assalamualaikum warahmatullahi wabarakatuh. Today we will present the topic how the Ministry of Health managed COVID-19 crisis in Malaysia. My name is Khairunisa Binti Muhammad Zuki. My ministry number 1181647. The Ministry of Health Malaysia is a ministry under the Malaysia government that is responsible for managing the healthcare system. Firstly, immunization program. This immunization program to ensure that all citizens receive the vaccine as soon as possible to create a people with a high level of immunity. Firstly, Special Committee on COVID-19 Vaccine Supply Access Guarantee. The main function of this committee is to ensure that the COVID-19 vaccine was available to Malaysians as soon as possible, safely, perfectly, and effectively. Also serve as the main committee for the National COVID-19 Immunization Program. Under it also, GKGAV has managed to secure vaccine supply from different suppliers such as Pfizer and Sinovac. Secondly, Vaccination Center or Pusat Pemberian Vaksin PPV throughout Malaysia. Malaysian government has established 605 vaccination centers throughout the country to achieve universal coverage. Before going to take a vaccination, people must make an appointment first on the My Sejahtera or on the official website portal vaccinecovid.gov.my to get a vaccination date. Individual to be injected with a COVID-19 vaccine at the PPV will have to go through 5 stations at the vaccination center, with the injection process taking between 15 and 30 minutes, including a monitoring process for side effect. Thirdly, set up Malaysia Vaccine Sport Volunteer. My work is a collaboration between the Malaysia of Health and Mohd, KBS, Mohd, and MRCS. That's all from me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syakinah Binti Amli. Next, I will go through with the second point, which is mental health and psychosocial support services. Some initiative has been taken, which is continuous support from frontliners and health professionals. MOH has established the mental and psychosocial support services, MHPSS, to provide a range of local and external support. They also implement an online counseling services and psychological first aid station for health workers, and providing soothing support and adequate mental health treatment for the public. The second one is they're also creating a psychosocial support helpline. This helpline is operated by MOH counseling psychology officers with volunteers from various agencies and NGOs assisting them. Besides, they also collaborate with other government agencies such as the Malaysian Islamic Development Department, JAKIM, and the Ministry of Women, Family and Community Development by creating some respective helpline such as KSK Care, JAKIM, and Talian Kasih. And the last one is they also provide mental health education and webinar session through daily webinars and Facebook live events. They also distribute COVID-19 information and mental health education in formal language such as Malay, English, Mandarin, and Tamil language. That's all from me. Thank you.
My name is Azza or Aidila binti Azmi, metric number 1181644. Okay. My Sejahtera application. My Sejahtera application is a mobile application developed by the Malaysian government to aid in the management of COVID-19 outbreak in the country. It enables users to assess their own and their family's health. During the COVID-19 pandemic, people can also track their health progress. In addition, My Sejahtera allows the Ministry of Health to keep track of users' health and respond quickly to their needs. My Sejahtera application was created to aid the government in managing and minimizing the COVID-19 pandemic, to assist users in monitoring their health throughout the COVID-19 pandemic, to assist users in receiving treatment if they are diagnosed with COVID-19, and to locate nearby healthcare facilities for COVID-19 screening and treatment. First, give COVID-19 data cases. My Sejahtera function as a medium to alert Malaysian citizens about COVID-19 daily data cases. The application provides a detailed COVID-19 data cases according to the Malaysian respective state. Second, health screening. Screening are diagnostic exams that look for diseases before symptom appears. Screening tests can detect diseases early on when they are more treatable. In our doctor office, we can get some screening and medical specialized treatment necessitating a visit to a different office or facility. COVID-19 testing are currently divided into two categories: diagnostic tests and that search for active coronavirus infection in your mucus or saliva, and blood tests that search for antibodies, which indicate that your immune system that has previously encountered the illness. Third, make appointment with hospital. By using MySejahtera, we can make an appointment with various clinic or hospital that joint ventured with Ministry of Health by clicking digital health icon in MySejahtera application. We can easily book or make an appointment with digital clinic and get advice from doctor through online. There's no need to queue long in the clinic or hospital if there is a concern about our health. There are several digital clinics that joint ventured with Ministry of Health, which are QueenMed, IncoMed, BookDoc, and Ministry of Health Clinic. That's all from me. Thank you.
Bismillahirrahmanirrahim. My name is Siti Najihah Binti Ibrahim. My metric number 1181643. Okay, next we will proceed to quarantine and treatment centers. For our information, self-isolation refers to the separation of ill persons with contagious disease from others for the purpose of protecting non-infected person. Then the government has decided to develop a quarantine center which can help those who have a residence that is not conducive to a quarantine at home, such as a house that must share a toilet with other family members. Okay, then how does the Ministry of Health of Malaysia manage this COVID-19 case at the quarantine and treatment center? Okay, for the first point is taking the patient to a quarantine center by ambulance. Okay, the MOH will take in accordance with the SOP set by them, and then they will come wearing a PPE suit. And the purpose of wearing a PPE suit is to shield themselves from droplets from cough, sneeze, or other body fluids from infected patient, and contaminate surface that might infect them. And then for the second point is daily health monitoring by MOH staff, and this is something that has been shared by the patient themselves who have experienced quarantine at the quarantine center, which is every day in the morning and at night. The staff at the quarantine center will examine each patient, and the staff they was ready to send medicine to the patient in their beds to ensure that they ate properly, even though they had to send one by one. And the last one is provide activities to give a positive aura to the patient. Okay, for someone when confirmed positive COVID-19, it's not easy to accept. Perhaps it will be thought of the consequences of pain that will be faced. Either can continue to fight for life or will die, because we know that COVID-19 disease is a disease that is not easy to fight. It is a very dangerous virus, right? And among the activities provided by the MOH are table tennis, carom, watching television, aerobics, and others. And then anyone who is a Muslim, of course, congregational prayers will always be done. And then with the activities done, it can help a patient not to think too much nonsense and not stress, because it is not something good for a patient and even worse, his health. That's all from me. Thank you.
Okay, my name is Syazwani Binti Shaharuddin, metric number 1181645. Next, on how MOH manage COVID-19 cases in Malaysia is by using self-test kit. Self-test kit can be used by anyone who is symptomatic or exposed to someone suspected or confirmed COVID-19. This kit is a single-use test kit to detect COVID-19 in human oral fluid. This kit is approved by MDA, which is Medical Devices Authority. There are 58 brands of test kit that authorized by MDA. For the complete list of the brand authorized by MDA, we may refer to MDA's official portal. Individual may buy authorized test kit from authorized premises such as health facilities, pharmacies, and KK-Mart. Government also set ceiling price for self-test kit, which is RM19 ringgit 19 cent a unit for retail price and 16 ringgit for wholesale. Recently, test kit also available at 6 ringgit and 19 cent a unit. Next, individual may refer to instruction provided by manufacturer on how to perform a self-test. And after performing a self-test, individual must submit the result regardless positive or negative via MySejahtera application. Next, this is overall classification outline for our presentation, and this is references for our presentation and assignment. Thank you.